Today I'm excited to present my work, which focuses on the wearable sensor, building a wearable sensor for continuous blood flow monitoring via multi-wavelength photoplethysmography. So before we dive into the science and technology, why do we care about continuous and remote blood flow monitoring? Why is it so important? It has been shown that microvascular dysfunction often appears early in disease progression, and its detection can provide early prognostic information for disease prevention. Now, despite this prognostic value, remote quantification of blood flow currently is very limited. There are methods that exist out there, namely the laser Doppler flowmetry device, that is the most well-known tool used for blood flow measurement. However, and it is the most well-known tool for blood flow measurement because it has strong validity. However, it is hard to implement into a remote monitoring device due to its bulkiness and also lacks scalability because it is a costly technology. To overcome these challenges, we are taking advantage of PPG, photoplethysmography, which is a simple, low-cost optical method that can be easily incorporated into wearable devices. It is a well-established technology that is implemented into commercial smartwatches and wearable devices that we are all aware of, and that is able to provide us many cardiovascular information. Now, with PPG, we can leverage the depth dependence of light to tap into different vascular beds to extract even more information. One of the key derived data that I wanted to focus on for this presentation is the arteriolar pulse transit time. Now, what is the arteriolar pulse transit time? It is essentially the time it takes for the pulse wave to travel from the deeper arteries vertically through to the shallower capillary beds. Now, in vasoconstricting conditions, our vessels constrict, and it decreases the blood flow. It also increases the time it takes for the pulse wave to propagate. In these conditions, we see an increase in our APTT metric, and vice versa in vasodilating conditions. The vessels dilate and blood flow increases, and we see a decrease in the APTT. Keeping that in mind, we hypothesize that this APTT metric can provide us information on blood flow. Now, to test our hypothesis, we developed a multi-wavelength PPG wearable sensor. And this sensor consists of 6 LEDs with different wavelengths, ranging from 468 all the way to 970 nanometers, and 4 photodiodes that can help us quantify pulse wave dynamics that's happening within the skin. Keeping in mind, again, that the longer wavelength is extracting signals from deeper arteries, and the shorter wavelength is giving us information from the shallower capillary beds. Now, with this newly developed sensor, we wanted to test this sensor and the APTT metric that I presented against the laser Doppler, using that as a reference device. And in our protocol, as you can see here, we have our sensor on one thumb and the laser Doppler probe on the contralateral thumb. And we collected data at the same time. And to induce a vasomodulatory stimulus, we performed a unilateral foot submersion in ice water as a vasoconstricting stimulus. We collected data from both our sensor and the laser Doppler, exported the data, and we processed the data using MATLAB scripts to calculate the APTT metric and to plot the data together. Now, what we found is this correlation between the inverse of our APTT metric and the reference laser Doppler blood flow measurement, as you can see on the top right graph there. The trends match quite nicely, and this held true across different individuals. The Blend-Altman analysis that we performed also yielded a really strong agreement between the two blood flow metrics. Now, this validated our sensor for blood flow measurement. Now, the work here is not done. Although we have validated the device for blood flow measurement, we know to date that, we know that melanin plays a huge impact in pulse ox measurement, where it overestimates the SpO2 value in darker skin tones. We need to explore whether melanin plays an impact on our arterial pulse transit time metric as well. And also, to date, we have only tested this device and the APTT metric on healthy individuals. We are collaborating with Dr. Catherine Howe from the Toronto General Hospital Vascular Surgery Lab to test this in vascular patients, particularly the peripheral artery disease and CLTI patients. And then lastly, previous studies have shown that the combination of blood flow and heat can be used for endothelial dysfunction assessment. In healthy individuals, we see this unique biphasic pattern in blood flow in healthy individuals that are absent in diseased populations. So we're leveraging going beyond the blood flow monitoring capability. We're looking to use this to expand the clinical use of our device. Now, tying it back to why remote monitoring is so important and why this work is so important, remote monitoring of skin blood flow provides us key information on progression of various diseases. It can serve as a cardiovascular stratification tool, which ultimately will enable clinicians to assess risk and intervene before devastating clinical events like heart failure and other cardiovascular diseases. To conclude, I wanted to thank the Franklin Research Lab and my supervisor, Dr. Daniel Franklin, and my co-supervisor, Dr. Catherine Howe, who have both been instrumental in helping me navigate through this project.